Thank you everybody for coming. Wanted to be able to give a general update on COVID-19 in the area. As of today, May 25th, COVID-19 cases in the last 14 days are at about 85 cases per 100,000 population. We've seen a significant drop in the last couple of weeks. Chelan County had 81 positive cases and Douglas County had 24 positive cases. Hospitalizations have been steady between 5 to 7 in the area. And as of close business on Saturday, the Town Toyota Center has done over 57,200 vaccines administered. As of last week, 1,511 vaccines were administered. 403 of those were second doses, 168 were part of our equity clinic, and 940 were from our public clinic. Currently, everyone who's 12 years and older eligible for the COVID-19 vaccine for Pfizer. Only Pfizer is authorized for 12 to 17-year-olds, and 12 to 17-year-olds need to have a parent or guardian provide consent in order to access the vaccine. The consent form is on the CDHD website and is distributed at sites with providers who are giving Pfizer. Quick update on masking. On May 21st, Governor Jansley extended the Healthy Washington Roadmap to Recovery proclamation and updated the Safe Workers proclamation. And a summary of those changes include face masks are still required in healthcare settings like hospitals, long-term care, or doctor's offices, correctional facilities, homeless shelters, or schools. The federal order requiring masks on public transportation still applies. People who aren't vaccinated are still required to wear a mask per the Secretary's order, Secretary of Health. Counties and businesses have the right to set their own rules and regulations on face coverings to respond to the level of transition in the community based on their staff's vaccination level and other. We are asking that if you walk into an establishment that requires masks, that you will be asked to respect those rules. And that's why we're saying respect the rules of the room you're in, because it's an easy way to remember that there's no one-size-fits-all solution for everybody or for masking across the state. And people may have reasons for wearing masks that we want to respect their decision in their space. Town Toyota Center is currently still only administering Pfizer vaccine. It continues to accept walk-ins with no appointments. As of next week, Town Toyota Center is going to be changing operationally starting Tuesday, June 1st. The National Guard will be demobilizing. Chelan-Douglas Health District and Lifeline, in partnership with Town Toyota Center and other partners, are going to be taking over the operations here, making sure that we have continuous vaccination available for Chelan and Douglas counties at this site. The new hours of operation, when we take that over, will be from Monday to Thursdays, 11 to 6 p.m. Friday, Saturday, and Sundays, the Town Toyota Center will be closed, and we're hoping to continue offering the high level of services that have been offered here previously. In terms of the roadmap to recovery, as of May 18th, all counties in Washington moved to phase 3 on the Healthy Washington reopening plan, and will stay in that phase until June 30th. Full reopening could happen earlier than June 30th if 70% or more of Washingtonians 16 years old and above get vaccinated. And currently, we're asking people to follow Chelan-Douglas Health District on Facebook and Twitter at Chelan-Douglas HD for updates. And we're asking everyone to continue helping us stop the spread of COVID. If you are unvaccinated, please continue wearing your mask. If you are vaccinated, you have that exemption, continue washing your hands and watch your distance. And don't hesitate, vaccinate. Visit www.cdhd.wa.gov and book your appointment today.
Hi, a question about the new masking rules. How does the health district feel about the sort of honor system that the governor mentioned in his proclamation last week? And if it seems, at least at first, that it might encourage some people that haven't been vaccinated, and if some businesses aren't going to be asking whether you are or not, they'll just walk in without a mask on. So is the health district will the health district be encouraging businesses to perhaps either make sure they have policies to check if someone's vaccinated, or just to implement a sort of mask on policy?
The Board of Health of the Chelan-Douglas Health District met last week. And with them and the health officer, we're still encouraging people to continue masking. People who are unvaccinated, who are choosing not to wear masks, are still taking a significant risk. About 90% of the hospitalizations that we're seeing are people who are still unvaccinated. And the illness is much more severe in that group. L&I has guidelines on employers verifying vaccinations, specifically for their employees. And the Department of Health and L&I will back any business that requires individuals to mask while on the premises. And part of the CDC's guidelines are to acknowledge the fact that the vaccines are very, very effective. And that is what allowed them to provide the guidance that they have an exemption from the masking rule. So the more vaccinated people are, the better protected we are.
Do you believe we will get to the 75% vaccination rate by the end of June?
Currently, we're looking at a 70% vaccination coverage rate. As per the state declaration that Governor Jay Inslee made. For Chelan-Douglas specifically, we only need to vaccinate approximately 8,000 people within the 2 counties to hit our local target. Chelan County is 4th in the state in vaccine coverage, just behind several very small counties and King County. This is an incredible achievement of all of our partners and all the staff at Chelan-Douglas Health District, and we're going to continue working towards that goal. The state currently is vaccinating at a rate to potentially hit 70% of the total state by the end of June. But that's just for the 16 and over population. But the second week of June, we should know whether or not we're going to be opening early or not.
Just to talk about the populations that you've been trying to get vaccinated, that maybe you've been having trouble to get vaccinated. Are you having any success in doing that? Is this becoming a more widespread vaccination effort?
Specifically, our outreach teams have had an incredible amount of success. And many of our partners have been able to vaccinate hard-to-reach populations with barriers. As we're shifting focus, we're still waiting on DOH to help us with some of our data. And we're continuing to ramp up our mobile vaccination efforts in order to reach more rural areas. So we know that we have a ways to go, but we're going to be continuing doing this throughout the summer and into the fall.
Can you give us some information on any booster shots, especially in relationship to Moderna and any other vaccines?
Currently, we're watching variants from across the world. Israel is actually one of our test cases since they've had an incredible amount of coverage there. And they have a really robust system for monitoring breakthrough. The technology for Pfizer and Moderna will allow us to develop the technology within 48 hours of identifying a significant breakthrough variant. And depending on production, that can be anywhere between 3 to 8 months before that booster is available. And one of the pieces that we're looking at that we still don't know about yet is the length that the vaccinations will last. And from some of the initial vaccinations, right now, it's looking like it's lasting longer than we initially predicted. So we're probably anticipating boosters and or new vaccines sometime in 2022, similar to how the flu vaccine rolls out.
As to the vaccination cards that people get, some people say that you can laminate them. I was told I could laminate mine after my second shot. Is that preferred? If we're going to be having boosters, should we be laminating our cards?
Laminating the cards, I think, would be fine. With the booster shot, as it comes down, I think probably what we'll be doing is generating some type of sticker or something that would go on there and make it a little bit more automated. Those are some things that we could potentially look at doing. But having people kind of verify that, depending on what policies come down the line in terms of international travel. I know that a lot of countries are not allowing Americans currently to travel to them unless they have proof of vaccination. And so, yeah.
So as far as those that are still not receiving the vaccine, do we have an idea of how many people that is? And are they saying why they're not getting the vaccine? Do we know why?
So currently in Chelan-Douglas Health District, it's approximately, you're making me do mental math. I usually go the other way. It's approximately 40% of the population, eligible population, which is around, I'd say probably about 30,000 eligible individuals. A lot of the stuff that we're hearing has to do more with hesitancy. There is a small portion of those, I'd say a very small portion, who are anti-vax or anti-vaccine, and they tend to have a very loud voice. And you know, our target population are individuals who are still open to getting vaccinated. We offer it to anyone who potentially would change their mind, but we're really looking at people who are not sure yet. Is some of the stuff that we hear, individuals who want to kind of wait and see how the vaccines turn out, and then individuals who may not have had an opportunity yet. They're too busy, have something else going on. So those are kind of the main three things that we hear, 3 or 4 things. And currently Washington State Liquor Cannabis Control Board has approved an intervention that allows for people who are vaccinated between now and June 30th to get a free beer depending on a local brewery or winery partnership. So we're looking at lots of different options to be able to encourage people to get vaccinated and initiate.
As we progress and we're getting close to the deadline, we want to make sure that we don't come short, you know? I want to make sure that what can we do as media to increase the outreach, to motivate people. I don't know, we already have some public service announcements running, but is there anything else we can do to make some people change their mind?
Currently, hyping up the vaccine is a great way to do it. I think people go to where they trust information to come from. And as trusted sources of information, of being able to continue to just state, hey, you know, get vaccinated, now is a great opportunity, and more likely to get back to normal when the summer hits. The state is looking at other incentive programs, potentially. Other states around the country have done things like a $100 savings bond, the lottery that was mentioned, and so people are getting really creative with how to incentivize vaccination across the U.S.
In anticipation of the June 30th reopening, I've already been getting emails from certain businesses about, you know, what is that going to look like? Is it really just going to be, you know, free for all, more or less? So in the local health district, you know, give us a sort of sense of what that's going to look like and what businesses should, you know, begin to, you know, prepare for, considering, you know, like a theater, for example, if they want to put on a show by that time, and what's it going to look like?
The Department of Health is still working on that guideline and that guidance. Initially, what has been expressed to local health jurisdictions is that restaurants and businesses would go from the 50% capacity that they're at now to potentially 100% capacity. Areas, things like choirs and or theaters and other kinds of things, that guidance will be coming out through DOH. Similarly, with events and event centers, that guidance is still yet to be seen. Governor Jay Inslee has still expressed that we will still be in a state of emergency. So depending on breakthrough and or variants at that time and hospitalizations, currently it's 90% ICU capacity. We would be looking at kind of staying back in phase.
The Department of Health released a statement either today or yesterday about I don't want to say growing number of cases, but the cases of myocarditis, I don't know how you pronounce it. I don't know if the local health district has anything to add beyond what the Department of Health said, that vaccines are still effective and the sort of potential risk that myocarditis or whatever it's pronounced might produce is still outweighs the sort of potential side effects.
Right now, we're waiting for to do any action based off of CDC and DOH findings as they investigate this. Generally in the population, you see between 10 to 15% of myocarditis happen naturally. And it's usually tied to infection, whether that's COVID or flu or some other viral infection. And in many of those cases, vaccination actually helps treat and or reduce the severity of myocarditis. Public health takes very seriously any type of adverse event. An example of that is the Johnson & Johnson situation with the very rare blood clotting. And to make sure that people understand the risks of what they're receiving. And so DOH and CDC, while they're in the middle of evaluating it, a lot of what we're seeing looks like that it is baseline myocarditis in the population. If that changes, we will be very quick to make sure that everybody is aware of that risk.
Can you define
Myocarditis is an inflammation of the heart due to either infection or kind of an autoimmune response. And there's also pericarditis, which is very similar. All right, well, thank you everyone for coming, and we'll see you another time.